you, Elizabeth, and thank you for the invitation. And I'm honored to be in a group of so distinguished entrepreneurs. My name is Amit Mogalam. I'm the founder and CEO of AscendantDX. Our goal is early detection of disease, and our first project is breast cancer. A bit of history. The first reported case of breast cancer was reported by Herodotus, and it was Atusa, the queen of Persians. She felt a lump, and she was bleeding from her nipple. Sadly, for most of the world, outside the United States and a few developed countries, that's still the standard of care. That's how you find out you have breast cancer. The secret of survival of breast cancer is early detection. Stage 1, 93. Stage 4 drops to 15. US is probably the most sophisticated country in terms of screening for breast cancer. We have deployed about $5 trillion worth of equipment in 8,000 clinics, and we spend $8 billion annually maintaining that. 50% of it is completely wasted because the equipment we use is pretty much only 50% accurate. It costs us about $26,000 to diagnose one single case of breast cancer. Any other country developing the process is crazy to follow our lead. And we only reach about 40% of eligible women between the ages of 45 to 70. The rest of the world, it's not that good. Mortality rate is about 40%. High, 58% in Africa, and a little lower in developed countries. That is the data that animates our work. And with the help of volunteers from all types of women who have just been diagnosed with breast cancer, our research team have come up with a new solution, Melody. It's a fast, accurate, and inexpensive test for breast cancer. We look for protein biomarkers. These are biomarkers that are present because the disease is present in your body. And we could detect those in tears, not blood. You can think of tears as concentrated blood. The reason we can find these highly low abundant markers in tears is because it is highly concentrated. And we've done 3 clinical rounds of validation. We've tested 75, 150, and 300 patients, the last one being 300. And our next step is 1,000 patients clinical trial and a regulatory path. We're nearly 90% accurate. The test essentially starts with a piece of paper, it's a Shermer strip, ophthalmologists use. It gets saturated with tears. After that, we elute it using saline, and that liquid goes into a cartridge, a very inexpensive cartridge, and very much like a pregnancy test, it lines appear. There's a business here. A third-party consultancy has estimated that an IVD test in this market has somewhere around 11 to 17 billion. There is a potential to sell about 45 to 65 of it in the US, 1 to 1.5 worldwide. Have a team, 22 startups, $100 million that we have raised for those startups, 5 exits, doctorates, patents, papers. But we have the McCarthy Genius, and we have one of the former drummers for the Turtles. We also have an Ashoka fellow.
That was a buzzer.
And by the way, for a lot of us, this is more than just an adventure. My mom, one of our first volunteers, lost her life to cancer. She was a 13-year survivor.
Thank you. So we'll have 3 minutes of Q&A.
Ahmed, first of all, great, love the pitch. How do you prove that it works? Like, do you have the FDA approvals that are required? I'm thinking of the headlines in Toronto, and all the issues with investors demanding money back. Like, how do you demonstrate that this works, and have you achieved the necessary approvals?
Not yet. So next step is we have done 3 clinical validation trials. This is what you need to do before you get to the clinical trial for the FDA. We have done, the largest one we did was 300. And we need one with 1,000. So you have all statistically valid in the matrix that you have to fill out with all the data. So the next step is doing that clinical trial and going through the FDA approval. But our data has been validated by outside experts. So it's not Toronto slide at all.
Omid, a question for you. I can see a great solution on the product side, but building the appetite to get the tests done, like people being tested. So getting your product to the people who need it and getting them to recognize the need to test. How do you ensure that that happens? So like the issue in some parts of the world, the issue is not unbetter iron supplement. The issue is people don't recognize the need to check whether they are. So how do you address that?
Well, breast cancer is I don't want to say it's a special type of disease. The fact is that it's very personal, and everyone has been affected by it. Even in developing world, there's a lot of Komen-like foundations that are doing that job for us. They're raising awareness of the disease. They're not offering much in terms of screening, but at least they're raising awareness. Clinical studies have shown that self-exam, sort of digital exam, doesn't really do anything. It doesn't affect, it doesn't change the number of diagnoses, but it raises the awareness, and that's what in the developing world these foundations are doing.
So at some level, you are dependent on those foundations to do their job well, so that you can then come in and supply.
I think they've already done it, actually. I mean, the awareness is raised, and the fact that people are using gold standards that are substandard, like mammography today, is the fact that that awareness has been raised. It's just that now the market needs something that's superior to that.
What's the either actual or expected reduction in cost, time, hassle? Like, kind of building on this question, is there an element of this where you can just do more screening more effectively because it's cheaper and easier? Like, what's your sense of that?
Well, it's more effective. For one thing, it's more effective, and it's going to be cheaper because it's not an expensive imaging test. It doesn't require expensive expertise or an infrastructure to run. So that's on the cost and effectiveness side. It can also expand your reach. Right now in the U.S., we only screen women between the ages of 45 to 70. Now women between the ages of 20 and 45, when breast cancer strikes them, it's extremely aggressive and deadly. But we never test them. We don't test men. The 2,200 men a year in the U.S.
That was the buzzer. Sorry, I didn't mean to interrupt, but thank you. Partner, thank you.